Testing. Testing.
Or
Thanks for coming, Nick. You didn't have to come in person, but thanks for doing it.
to get out of the house. There's a chance. See human beings.
Are we set? We're ready to go? All right, let's do it. Pursuant to Section 5, Chapter 231, Public Law 1975, this is to state for the record that adequate notice of this meeting has been provided to the public by posting and maintaining the annual notice of regular meetings on the bulletin board of the municipal building, by mailing the annual notice of regular meetings for 2023 to the News Record and Star Ledger in December 2022, and by filing said notice in the office of the Township Clerk.
Ms. Adams.
Here.
Ms. Cripe.
Here.
Mr. DeLuca.
Here.
Ms. Engel.
Here.
Mayor Daffis.
Here.
Whereas Chapter 231 Public Laws 1975, commonly known as the Open Public Meetings Act, requires that all meetings of public bodies be open to the public. And whereas Section 7A provides that the governing body has the discretion to permit, prohibit, or regulate the active participation of the public at any meeting. And whereas desire the governing body to comply with the provision of this act, same time to conduct its business in an orderly and expeditious manner. Now therefore be resolved by the Township Committee, Township Maplewood, that it does hereby prohibit, except as set forth in the formal agenda, active participation in the deliberations of the governing body by the public, and except as otherwise prescribed by law, does limit the public to the observations of the actions and discussions of the governing body at all of its regular and special meetings.
So moved.
Second.
Ms. Adams?
Yes.
Ms. Cripe?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Mayor Daffis.
Yes, we have a very special guest. We had a very special guest today here at Town Hall, and we believe he is with us online. Mayor for the day, Theodore Bertels. Is he with us, Mr. Wary?
So
All right. Just a minute there, Mr. Mayor. So we have invited him back this evening to lead us in the Pledge of Allegiance. Are you ready, Mayor?
yes, of course.
All right, let's do this.
Let us rise to say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Nicely done, man.
Guten Nacht, or as we say of English, good night. Hope you have a good night.
Do not leave us just yet, Mr. Mayor. We have a special proclamation we're going to read into the record in your honor. But we thank you for leading us into starting our meeting with the Pledge of Allegiance. You did a really nice job, and I see that you are ready to take over with your special pauses in the Pledge of Allegiance like a man does. All right, so welcome everyone to the December 5th, 2023 meeting. We remain fully hybrid. One more meeting to go before the end of the year and the start of a new year. As I mentioned, we have a special proclamation in honor of our mayor for the day. We have one appointment tonight for boards and committees. Mr. Lombardi is with us, and he is eagerly, waiting to be appointed on the Maplewood Fields Committee. We'll hear from him in a minute. Then we'll have our first public comment period of 2. The first public comment period is only for agenda items. We will then hear from the Board of Health, and we have a special presentation or 2 from the Board of Health this meeting, and we're excited about that. We have no ordinances on introduction or on final passage this evening. Are we having this public hearing, the second hearing for the CDBG grant?
Yes, sir.
I don't see Ms. DePalma, but I assume she will be arriving shortly for that. Or maybe she's joining us online to do that. Then we have administrative reports. We always follow the following order: Township Administration, Township Legal, Township Clerk, the Clerk's Office. And then we have our reports from elected officials. Tonight's order is Deputy Mayor Engel, followed by Committee Member DeLuca, followed by Committee Member Adams, followed by Committee Member Cripe. I always go last. We have 3 discussion items this evening. You see them in the agenda that's been published, the Juneteenth holiday, annual reorganization meeting, and we're going to have a presentation from one of our cannabis delivery applicants looking for local approval. And then we have our consent agenda, our second public comment period for any matter, and then we will adjourn and meet for our last TC meeting of 2023 on December 19th. So I will get us started with the land acknowledgement that we have been doing recently. We acknowledge that we live on stolen land. Thank you, whoever did that. The illumination is very helpful. The land we now occupy and know as New Jersey has been the home of the Lenape people for 14,000 years, according to some estimates. The Township of Maplewood offers respect to the Lenape people, recognizes their forced diaspora throughout the region and throughout Delaware, and acknowledges that the municipality was built on this small portion of the Lenape-Hoking. We honor the Lenape in New Jersey and elsewhere for their environmental sustainability and their cultural resilience throughout our nation's history. And we firmly commit ourselves to promoting the well-being and growth of New Jersey's indigenous communities and to provide opportunities for indigenous peoples in our community, in housing, economic mobility, employment, and cultural or artistic opportunity. Wonderful. So with that, we're going to have our special proclamation. As I mentioned, we had a very special guest today, Theodore Bertels, who is 7 years old, going very quickly on 47. This is a very smart young man. He is at SMS, South Mountain Elementary, and his parents won a Mayor for the Day auction at SMS's Casino Royale night many months ago, and we've been trying to schedule this Mayor for the Day celebration for him for many, many months, and we finally did it today. He was here. He took pictures. We had his own name tag up here. He met department heads. The clerk gave him a wonderful the tour of the murals here that tell the story of our town in this very room. And he also got to meet with different departments, Public Works, the police department, and our fire department. He got to see all their cool toys. But he really, really loved sitting up here. And he loved using the gavel.
Thanks.
And it was very hard to get him to go. So he's ready to serve. And I told him that I will serve as his campaign manager
And he
as
turned
soon as
18.
he is ready to run for office. So Mayor for the Day is an important opportunity for us to educate young persons about the responsibilities of their local government, the operations of the local government, what a mayor and the governing body do. Theodore Bertels won that chance to be Township of Maplewood's Mayor for the Day earlier today. He not only got to spend time and ask questions of me, but of other department heads within the township. And as you all witnessed, he led us in the Pledge of Allegiance this evening. So in recognition, I, therefore, Dean Duff, as the mayor of the township, on behalf of my colleagues, on this 5th day of December 2023, am honored to present the special proclamation in recognition of our mayor for the day to Theodore Bertels. And we hope that he was inspired today, and that he will continue doing really well in school and being a good boy at home, and one day making the world a better place, hopefully in government.
Oh.
All right. Do you want to say one last thing there, Mayor?
Well, sometimes you just so how I got into politics is I
Oh,
was
yes. You told us this earlier today. Please tell the world. Go ahead.
Have a good night.
have a good night. And also how I
Make it brief.
Good night, Mr. Mayor, and we'll see you out there in the community. Well done.
Well, he put his hands together. Well, let me tell you a story. He's a character.
His parents are lovely. And, he sat up here and he told us this whole story about how he got involved, how he's interested in government and politics in particular. And He's a big history buff, and he's studying different nations and different governments. And he is 7 years old. Okay. That is adorable and very, very exciting. Our future is bright. Okay. So this brings us to an appointment to one of our boards and committees, the Fields Committee. And we're really delighted to have Nicholas Lombardi with us tonight. Nick, come on up to the podium, please. Thank you for being with us. Introduce yourself and tell us why you're interested in serving on the Fields Committee.
Oh, hold on. Let me turn it on.
Let's just make sure that thing is on first.
There you
I
go.
see it. Can you hear me?
Yes, we can.
Thank you for having me.
Good evening.
My name is Nick Lombardi. I am interested in being on the Fields Committee by nature of my involvement with Cougar Soccer. I've been a volunteer on the board, a coach. I run the academy program for our youth. I've been doing that for about 2 years now. So spend a lot of my extra hours doing that, either with my kids or with kids in the community. I grew up playing soccer my whole life. I've been on a field most years. I still play as much as I possibly can with my schedule. And I recognize that we have some issues on our fields, access to the fields, condition of the fields, how often they get closed. And we are really interested in trying to find solutions to move forward, to make the fields better, whatever they may be, working with the rest of the people in the community to figure out the best way to do that.
Wonderful. Thank you for willing to serve the community and volunteer in this manner. I'm going to turn it over to our Deputy Mayor, Deborah Engel, for a motion.
I move to appoint Nicholas Lombardi as the Cougar Soccer representative on our Fields Committee.
I'll second your motion.
Ms. Adams?
I don't know. I have some hesitation with this appointment. But his daughters are adorable, so I'm going to vote yes.
Thank you, Nancy.
You're welcome.
Okay, so just for the record out there, folks, that was a
It's
joke.
my next door neighbor.
That was a joke. Okay, so we were about to have a roll call. Roll call, please.
So we had affirmative vote from Ms.
We have an affirmative, yes.
Ms. Cripe,
Yes.
Mr. DeLuca.
Yes.
Ms. Engel.
Yes.
Mayor Daffis.
Thank you and congratulations, Nick. And thank
Thank you very much. I look forward to it.
Appreciate it.
Yep. Take care.
You're welcome to stay. You have nothing else to do at home.
He said, not have plenty to do.
I'm sure you do. I'm sure you do. Pleasure, pleasure. All right. This brings us to our first public comment period of 2. This is for agenda items only.
Yeah, it's on the
Agenda items. Yeah. I'm about to call. Welcome. Energized. All right. So we're going to start with people who are here in person first, Mr. Wary, and then we'll move over to folks who are joining us online. And I believe we already have someone here who's welcome. Welcome. Please state your name and let us know what it is you want to remark about.
Carrie, I'm from Maplewood. I think most of you know me. I call on Maplewood Town Council to support a ceasefire resolution in addition to your anti-Semitism and Islamophobic discussion item tonight. I don't want to be complicit in the genocide of Palestinians. It's not hyperbole. The Israeli government has publicly and brazenly declared their intention to commit war crimes, and over 800 genocide scholars have signed on to an open letter calling for this a textbook case of genocide. I don't want to remain silent as 2.2 million Palestinian people, half of whom are children, are being held under a brutal siege with no food, water, fuel, or electricity, all while being constantly bombed in an open-air prison, one of the most densely populated places on earth. They don't know any second if they're going to live or die. Israel is bombing hospitals, UN schools, universities, churches, mosques, residential homes, bread lines, and bombing the area where they told 1 million people to evacuate to. Forced displacement is part of genocide. The death toll is staggering and nowhere near complete, as so many people are unaccounted for under the rubble. Estimates are over 16,000 and close to 20,000. Basically the population of South Orange or Maplewood. 80% of the victims are women and children, and over 40,000 have been injured. The dehumanization of Palestinians is fomenting a very dangerous environment for your Palestinian and Muslim constituents. Your own resolution said you stood with the Jewish community, but you only called to avoid civilian casualties and allow access to aid for Gaza. Will you also stand with your Palestinian constituents and show support by calling for a ceasefire? People from marginalized groups affected by colonialism and white supremacy are watching this moment carefully and with great clarity as our Soma neighbors justified genocide. This is not a war. This is not a religious conflict. This didn't start October 7th. It's 75 years of a brutal occupation maintained by apartheid and ethnic cleansing. Human Rights Watch and Amnesty International call this system of oppression and domination against Palestinians apartheid, conditions that Nelson Mandela said were worse than the apartheid they experienced in South Africa. Israel receives billions in military aid from the US, money that could go towards education, healthcare, or finally fixing all the New Jersey transit delays that we've had, which have been horrific. It's not anti-Semitic to stand against genocide. Some of the strongest solidarity has been from anti-Zionist Jewish people. When they say never again, they mean never again for everyone. You are not a terrorist for supporting Palestinians who want to live in freedom with equal rights on their land. You just did a land acknowledgement. At the start of the meeting, you pledged liberty and justice for all. Did you mean it? New Jersey Congress members Donald Payne Jr. and Bonnie Watson Coleman signed on to the ceasefire resolution. How many people have to die before our representative Mikey Sherrill signs on? Don't let yourself be intimidated about speaking out against genocide and apartheid. You are on the right side of history. Free Palestine, ceasefire now. And I have a ceasefire resolution that Oakland, California just passed. I can give it to
the clerk. Thank you. Thank you for your comments. Are there any other folks here in person who wish to comment during this public comment portion? Seeing none in person, we will move over to online. Could we give it another little time? That was quick. Okay, seeing none, we will close this public comment period. There will be a second public comment period toward the end of our meeting. This allows us to segue into our Board of Health meeting, and I'm going to turn things over to our Deputy Mayor, who is the Chair of the Board of Health. Deputy Mayor Engel.
Thank you, Mayor. Pursuant to Section 5, Chapter 231, PL 1975, this is to state for the record that adequate notice of this meeting has been provided to the public by posting and maintaining the annual notice of regular meetings on the bulletin board of the municipal building, by mailing the annual notice of regular meetings for 2023 to the News Record and Star Ledger in December 2022, and by filing said notice in the office of a township clerk.
Ms. Adams?
Here.
Ms. Cright?
Here.
Mayor Daffis?
Here.
Mr. DeLuca?
Here.
Ms. Engel?
Here.
Whereas Chapter 231, Public Laws of 1975, commonly known as the Open Public Meetings Act, requires that all meetings of public bodies be open to the public. And whereas Section 7A provides that the Board of Health has the discretion to permit, prohibit, or regulate the active participation of the public at any meeting. And whereas desire the Maplewood Board of Health to comply with the provision of this act, same time to conduct its business in an orderly and expeditious manner. Now, therefore, be resolved by the Maplewood Board of Health, Township of Maplewood, does hereby prohibit, except to set forth in a formal agenda, active participation in the deliberations of the Board of Health by the public, and except as otherwise prescribed by law, does limit the public to observations of the actions and discussions of the Board of Health at all its regular and special meetings.
So moved.
Second.
Ms. Adams?
Yes.
Ms. Cright?
Yes.
Mayor Daffis?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Thank you.
I move the approval of the BOH meeting minutes from November 8th, 2023.
Second.
Ms. Adams?
Yes.
Ms. Cright?
Yes.
Mayor Daffis?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes. Now I turn it over to our health officer, Ms. Davenport.
Hello, good evening, everyone. This is the last Board of Health presentation for the year, so it's very exciting. Mar, if you could forward for me. Oh, super, I can forward myself. Awesome, all right. I'm going to speed through my portion of the presentation, all important, and it'll all be on our township website. But I do want to get to my colleague, Sarah Taylor, who has some really great information to share with you.
I just want to remind everyone speaking on that mic that take pauses.
Move closer.
No, take pauses.
Okay.
Don't speak quickly because it's hard for the recording to pick everything up for folks who are watching online because there's a bit of an echo on that mic, unlike our mics up here.
Oh, good. Okay.
Yeah, just
Noted.
keep that in mind.
Thank you.
Okay.
So this has been a great year, starting with our mayor's wellness campaign. The last walk with the mayor event will be December 16th at Maple Crest Park at 10 a.m. So please join our mayor and have a great conversation with him as you get some exercise. Tomorrow, there's going to be an estate and healthcare planning Zoom presentation with Two Towns for All Ages. This is part of the mayor's wellness campaign and the Conversation of Your Life initiative that we're doing. This is going to be a great presentation and it is free. All residents should participate because it's important information as you talk about end of life issues and what should be done for everyone's choices. Another great reason why this was a great year was because at the League of Municipalities earlier last month, I presented on behalf of our professional organization in Jacho, but also Mayor Daff has presented on behalf of the Mayor's Wellness Campaign. So thank you to everyone who supported us in doing that. It was also a great year because Maplewood received Sustainable Jersey Gold Star in Health. We were the first and only municipality in the state to receive a Gold Star in Health recognition for this year. And we were the only one who was less than 30,000 in population. So I just want to say thank you to our administration and to our elected officials, to my department heads and my colleagues and everyone who's part of the community because we were recognized for all the good work that we do in health. Speaking of health,
Next time we're going to beat Woodbridge, though.
Yes.
yes, we have to get there before Woodbridge.
Always.
Speaking of good health, we assisted providing Thanksgiving food baskets. We provided 12 food baskets to members of our community. This was a coordinated effort with the Maplewood Women's Club, South Essex Fire Department, and the Health Department. So I just want to say thank you to the school district schools that supported and distributed them with us. And thank you to the Cronin family for delivering the pies and grocery store gift cards. They made families very happy this Thanksgiving. Speaking of food, we just want to remind everyone that the Essex County Final Grocery Giveaway will be held on December 21st. Moving on to the next section of environmental health. This is the rundown of our services for environmental health this November. I just want to highlight the 27 complaints that our staff have needed to address. Most of those are due to lack of heat, hot water, and or noise pollution. Here's a recipe for the holidays. Just reminding people to get vaccinated, wear a mask, stay home if you're sick, hand soap, use hand sanitizer, communicate whether you're coming with a cough or not, and safe travels to all.
I love that.
If you haven't taken a food thermometer to your last turkey, these are the temperatures that you should use to make sure that your food is safe and we can avoid food poisoning this holiday season.
That's awesome, right?
And again, we have, as part of environmental health, we want to promote that keep hot foods hot and cold foods cold. Notice the buffet. So again, if you're going to a buffet this holiday season, make sure that you keep the hot foods hot and cold foods cold. And we also have 12 days of safety. Part of our initiative for 2024 in the health department is to focus on injury prevention. All of these images, by the way, are available to the elected officials if you'd like to distribute them through your channels or social media. They're very amenable to being shared. And moving on to dog and cat licenses, which, as you know, we do these annually. Dog and cat licensing is very important because it helps us not only to keep a census count of how many dogs and cats we have in our community, which has increased, by the way, since COVID. But it also helps us because everyone who has a license has to have an active rabies vaccine. So this is super important because in 2023, we had 36 dog bites. This is up from last year where we had 24. And in the prior 2 years, in 2020 and 2021, we only had 10. So we've seen a big increase in this. And when people call us because they've gotten bitten, they want to know if that dog who is a resident of Maplewood has their rabies vaccine. And if their license were able to provide them with that information. And that gives a lot of consolation to someone knowing that they don't have to get post-exposure prophylaxis. So please get your dog and cat licensed before January 31st of next year. This is interesting. So there's an increased canine respiratory illness in the United States. It's a highly contagious upper respiratory infection for dogs. One of the recommendations by the federal health agencies is to avoid high-risk situations such as boarding dog kennels or dog parks and sharing bowls. We want to make sure that they are healthy as well. Moving on to communicable and infectious diseases, our nursing report. We had 3 reportable diseases that were investigated last month. COVID-19 vaccine is also available, and we want to make sure that people are able to find a COVID vaccine location. You can go to vaccines.gov to find your COVID vaccine location. COVID-19 in New Jersey is considered low based on the hospitalization rates that we have. But if you've been following national news, you'll notice that the numbers have been going up in hospitalizations. So we will be keeping a close monitor on that. Everyone here should have received the COVID test kits, just to emphasize and show everyone. See, it's so glossy and awesome. We do have these free COVID test kits available for residents to take. These are good things to test before you visit someone who might be at high risk for contracting COVID, just to make sure that you are all good to go. Because this is respiratory season, we have to talk about flu and RSV, as we've been talking about for the last 2 months. You can receive your flu shots at Town Hall. We still have those available. And we also give free homebound flu vaccinations to anyone, as well as COVID vaccinations when we have them. So we have flu vaccine if anyone needs them that are homebound. And again, just a reminder for RSV vaccination, this is available for those 16 and over may get the vaccine, but especially recommended for our seniors who are 75 years and older. They can talk to their healthcare provider for more information. Essex County is offering their mobile health clinic, but only flu vaccines at this time. And these dates are available on their website. They go up until December 9th, so next week. However, this is a big news for them. They're now offering vaccines for children Thursday, December 12th, and they hope to do this once a month, if not weekly, open to all Essex County residents. So we have informed our school nurses and our childcare centers that if anyone needs mandatory vaccinations to enter school, they can get them there, but they do have to register because it's by appointment only and they have limited capacity. But if there is a need, they will continue to provide more services on a weekly basis. Moving on to social services and mental health, there is a winter termination program through the DCA. From November 15th through March 15th, you can prevent your heating to be cut off if you sign up for this winter termination program to assist you with payment of utilities. So for those of you who could use this service, please take advantage of it. And if you need assistance, you can call the health department. We'll be happy to assist you in signing up and registering for this helpful service. As a reminder, as I've been mentioning, access to care is available because people have health insurance. Just to note that Medicare open enrollment will end in 2 days on December 7th. So please sign up for Medicare open enrollment if you are eligible. And for those who have a New Jersey Family Care Renewal Packet, please check the mail because they're not sending it to you electronically. And if you don't renew, then you don't get insurance after December of this year. And so we want to make sure that people are healthy and keep healthy by keeping all of their medications away and out of sight. One statistic that you may have heard me say before is that 70% of those who have an opioid addiction started because they had access to someone's medication in their home. So that could be your family member, you're visiting your grandparents. Please keep all medications out of sight. And again, just a reminder, people can go to the Maplewood Police Department lobby and dispose of any used or expired medication just to get them out of sight and out of your home for the holidays here at 1681 Springfield Avenue, which is the police department. And they're open 24 hours a day, 7 days a week. Lastly, just a reminder of an image that we created. These are the crisis numbers that people should know about. Surprisingly, lots of people don't know about these numbers. Everyone knows about 911, but they may not know about 988. So during the holidays, mental health crises can come about actually in more frequency, unfortunately. So please advocate for people to use the 988 number. All of these numbers are available 24 hours a day, 7 days a week for mental health and emergencies. Social services, as we've talked about, is the 211 number. And of course, poison control is nationwide, and that's 800-222-1222. All of these numbers should be programmed in every kid's cell phone because this is a really great information to have. And lastly, for those who have family members who are visiting over the holidays or who have suffered an injury and need recovery, we do have a free medical enrollment loaner program. So we've had this program for a long time, but we do want to advocate that if anyone needs a wheelchair or walker to help them recover or to assist a family member who's visiting to be mobile and enjoy the holidays, please contact us and we're happy to pay it forward. So this is the main part of the presentation. And I just want to introduce my colleague, Sarah Taylor. She is our local health outreach coordinator at the health department, and she's going to give you some great information about herself, but also about the data that she's able to find on behalf of the health department. I just want to say that Sarah Taylor is the future of public health in that she is able to analyze and use data and pick out metrics so that we can measure what we do and really target those priority populations, which she will go into. And she's also able to implement the outreach. So as we're getting out of COVID made us realize that there are priority populations and we really need to get to them. How we get to them is going to be through the support of the township and through some of the great services that she's able to partner with. So without further ado, I'm going to pass it over to Sarah Taylor. Thank you.
Brought help, huh?
Hi, thank you for having me up here today. So before we get started, I want to tell you a little bit about me. I am a local resident.
Just make sure you're speaking into the mic. Yeah, there you go.
There we go.
You may have to lean in on occasion. I'm sorry.
No, you're
One of these days we will have an appropriate mic. We're not there yet. But yeah, please go ahead.
I'm a local resident. I've lived here for a little over a year and a half. And I've also been with the health department for about 6 months now. I'm about to start my final semester in my master's in public health at NYU. We're so close. And then I received my bachelor's in public health from the University of Alabama, Roll Tide. And that is my dog, JJ. You might see her running around events in the town.
Excellent.
So today I'm going to take a little time to tell you about the Strengthening Local Public Health Capacity Grant we received through the New Jersey Department of Health. This is our third year with the grant and originated during COVID pandemic as a way for local health departments to increase their ability to respond to the pandemic and other emergency situations. Over the past years or so, they've begun the transition for the grant to focus on all infectious disease response, outreach to priority populations, and support. My role in the health department is the local health outreach coordinator. So I work closely with each person in our health department. And while I sometimes classify my role as the Jackie of all health department trades, I break my job down into 3 specific roles. I work as a social services liaison, community health education and outreach programs coordinator, and the grant reporter. Finally, before we dive into this presentation, I want to take a moment to discuss 2 key terms. The first is priority populations, also known as vulnerable populations. These are groups of people that are at risk, underserved, or inequitably affected by health or social issues. And the other we're going to talk about is social determinants of health. These are the non-medical factors that influence health outcomes. A few examples of these are physical environment, economic stability, food, culture, and education. Later in the presentation, I'm going to go over a few specific examples and how they are in our community. Local health departments, as you may know, face limited local and on-site capacity. So because of this, it's really important for us to network, build community partnerships, and secure further funding. A big part of our grant is increasing our ability to link people to social services. I created this chart as a way to show how one of my cases went. They all pretty much follow the similar pattern, with changes in the resources and community partners utilized according to the resident's specific needs. This particular resident was connected with us through a community partner. Once I met with them, we identified that their primary needs were food insecurity and employment. From here, they applied for SNAP, and after that, we were able to get them connected to Mend on the Move with OLS, Our Lady of Sorrows Church, and Mend. This allows for them to get weekly grocery deliveries while they're waiting on their SNAP benefits to get approved. And as you also may know, this is not a short process, waiting on any benefits to get approved. And they were ultimately feeling really lost in the government aid process. They were calling repeatedly, hitting brick walls. Thankfully, Essex County has the coordinated entry hotline. And through this hotline, they were actually able to reach out to the offices and get them their SNAP applications pushed through. So after that, they're on the last few weeks of Mend on the Move deliveries. They receive SNAP and we connect them with extensive community and employment resources. And below is just an example of the few community partners in this specific situation. Now that we've discussed the general flow of my process with residents, I'd like to talk to you a bit about the rapid public health assessment I completed as a part of my position within the grant. This assessment allowed for me to examine the needs of our community and identify solutions and community partners. One of the main resources I utilized while conducting research for this was City Health Dashboard. City Health Dashboard's interesting. It essentially standardizes and aggregates all the data on health by city. It provides city and census tract level data on over 40 measures of health outcomes, determinants, and equity. This has traditionally only been available for cities with a population greater than 50,000. This year, however, was their first year with the Put Us on the Map challenge, which allowed for cities or townships with a population between 3,000 and 50,000 to apply to be added to the dashboard. We were one of the towns selected and are now one of the 950 included on the dashboard, and it went live this summer. This is available for everyone. It's free and open information. You just go to www.cityhealthdashboard.com and you can look up your city and compare it with others as well. These resources are really important because the county and state can only scrape the surface of data collection and presentation. The City Health Dashboard has allowed me to examine our municipal level data to identify priority pockets and communities within Maplewood that are easier to miss when only viewing data at the township level. Over the next few slides, I'm going to show you a couple of examples of health indicators that they utilized and how I examined them for my assessment. These two charts are just a couple of examples that they include. The first is the percent of population less than 65 years old who were uninsured in 2021, where about 89% of our population fall under less than 65 years of age. The second shows the percentage of adults age 65 and up that report receiving preventative services in 2020. I selected these two specific examples because at first glance on a township level, we did score particularly well against other dashboard cities. And this is wonderful, and it shouldn't be minimized by any account. And this is the extent to which the data would be viewed on a county level. My job as the local health outreach coordinator for Maplewood is to dive deeper into this. Within my role, I know we have communities in Maplewood where this isn't necessarily representative. I was able to take this data, break it down on a census and community level to individually analyze the insurance rates and preventative rates for each community. After examining this, I was able to see that there are communities and neighborhoods in Maplewood where their specific uninsurance rates are actually as high as 10.3% of that given neighborhood.
Interesting.
The same applies to preventative services for 65 plus statistics. While on a township level, 41.3% of older adults in our town report receiving those services, there are communities where only 35.7% of that specific neighborhood received them. This is why data analytics are so important in my position. We may score well as a town, and that's great, but the distribution of services isn't always equitable. From these measures, I've been able to pinpoint exactly where we should be focusing our attention and pushing resources and building out interventions. Another big part of our health assessment was looking at some of the social determinants of health, those non-medical factors I mentioned earlier. These affect our communities in unique ways. And while the chart on my actual assessment is much more expansive, I chose 3 to share with you today, and a few of the short-term strategies we use to mitigate this. The first is healthcare access. We talked a little about it before, but for this, we offer health screenings. We connect people to federally qualified health centers for their vaccinations and physicals. And we also offer mental health screenings and services, connections to the services. The second here is language barriers. According to census data for Maplewood, 21.4% of our population actually speaks a language other than English at home. So because of this, we're sure to translate our community resource guides and other resources into Haitian Creole and Spanish. The third determinant I identified is community engagement. Community engagement and the civic process and general knowledges of service isn't always spread equitably. The civic participation is associated with improved health. It also promotes inclusion and affirms identity within your community. So for this, we table at local events, we network, and we send out weekly resource newsletters to keep people connected to what's available. To end our time together tonight, I want to focus on the key points I identified for myself in the department for 2024. I utilized Healthy People 2030 to choose a few of their objectives to work for in our community. If you're not familiar with it, Healthy People 2030 sets data-driven national objectives to improve health and well-being over the following decade. My 3 key focus points for 2024 are to prioritize injury prevention and community safety. This includes accidental injury, motor vehicle, suicide, overdose, and workplace injury, just to name a few. Improve health, well-being, and inclusion in people with disabilities. About 1 in 6 people have some sort of disability in Maplewood. And also the prevention of drug and alcohol use in adolescents and adults. Maplewood has about 18.15% prevalence in binge drinking.
Wow. Can you show that again? I'm sorry. I think that's important.
Yeah. So
The drug and alcohol use in adolescents and adults in Maplewood. Wow. That's really telling.
very much so. So for this, I could sit here all night and tell you our proposed and upcoming programs we want to utilize, but I'm going to share just a few. And I also chose these, just they're relevant issues in our township. They align with our new master plan, and they also align with national goals for progress. A couple that I'm bringing here for injury prevention are Safety Towns. It's a safety program with Safe Kids of Essex County, which helps through kind of a field day game environment, teach kids about pedestrian, bike, home, and water safety. And we're also partnering with Project BEST with the New Jersey Department of Human Services to bring glaucoma screening for older adults. We're partnering with Soma 2 Towns for this as well. Undiagnosed or untreated glaucoma can lead to risk of falls, depression, and also loss of ability to perform daily activities. We're also working, this one falls more under our prevention of drug and alcohol use. We're working to expand our municipal alliance. Our town's municipal alliance works to promote mental, social, and physical health of our community members for an environment free of drug and alcohol misuse. These 2 graphics are actually a part of the membership campaign we've begun. The left is for general members, and the one on the right was targeted for youth. And since launching this campaign, we have added our first youth member to the alliance. And I really look forward to our 2024 year working with them to receive their valuable thoughts, opinions, and ideas about how we can better get out there in the community with it. That is the end of my presentation for tonight. I want to thank the Township Committee for your continued support in our drive to improve Maplewood's health and well-being. We look forward to another great year of support and seeing you at our events.
Sarah Taylor, let's give it up. Sarah, if you were nervous, it was not obvious at all.
Oh,
My goodness, that was fantastic. Thank you.
Thank you. Yeah.
Thank you very much. That's great information.
Yes, thank you. I was going to say the same thing. You give a very good presentation. So thank you so much.
Thank you.
Do I have any questions for either Ms. Taylor or Ms. Davenport from any of my TC colleagues?
I have a couple questions, if I may. I'm going to go all over the map based on the presentation, and then a couple things that came up this week in the community. You know what I'm going to say, right? Health Officer Davenport. There were a few coyote sightings, definitely coyotes and not foxes. So I think we need to have the what do you do when you see one information readily available on the website. Even for someone like myself, I was struggling to get the number. I was calling the county, and it was a hot mess in that moment in time. And of course, by the time we got to someone, they were gone and they couldn't locate them. So we need to have that information on the website readily available. Is there anything you wanted to remark on the record about that?
Yeah, I'm just making a comment to the website.
Right. And then generally just having also some advice on behavior, right? On the website about that. Don't engage, don't try to feed, don't be aggressive with, that kind of thing. Right. Okay.
Run the other way, right?
Yeah, I'm not sure if you should run, right? Because they might, yeah.
Yes, thank you.
Did you want to say anything about that?
No. We do have information on animal control and interaction with wildlife on our website, but coyotes are a new thing for us. We usually see like raccoons or badgers or the occasional fox, but coyotes are a little bit more unpredictable. So we will definitely bring that to the forefront of our website so that people know what the process is for reporting.
Fantastic. The other issue I want to bring to your awareness is that I've been in a couple of different settings this week where in which folks have come up to talk about feral cats, that our population has increased.
Okay.
And they think that we need to do more outside of our relationship with Bloomfield and animal control to sort of take a handle on that. And that may include re-engaging some former volunteers in this and finding a way to partner with them so that they can get on top of it. Anything you want to say about that?
If you have contact information for those volunteers, we'd love to meet with them in the new year. And
I think you know who they are. Yes. And so do you. Yes.
Because we can't do anything regarding feral cats without the help of volunteers in the community.
Right.
They are feral, and so they populate, and we really do need hands on the ground. And because Bloomfield has been fantastic animal control, they are not local, and so if we can have the help and assistance with our volunteers and create a coordinated process, I'd be happy to do that.
Wonderful. I have a model out of West Orange that folks have asked us to consider. So I will forward you that information. Perhaps at the next Board of Health meeting in the new year, you can report on that.
Yes.
If you're willing.
Happy.
The city health dashboard. So I'm really excited that we're on that because last year, as you remember, Health Officer Davenport, when we were at the League of Municipalities and I was giving a presentation about our health assessment, we weren't allowed to be on the dashboard yet because we were not a municipality above 50,000 in population. So I'm glad that we're on there. So what kind of information do we have access to right now and how are we using that data or information? Sarah?
Hi. Okay. So once you click on there, you could see it a little bit on the screen. You'll essentially type your town's name in, and then it brings a whole list. So you can look at anything from health factors such as high blood pressure, heart disease, diabetes, like a whole range. And you click on each one, and the dashboard's great because it really presents everything in a clear way. And it also explains what each measure means and the check marks and the lines. From there, you can break the data down. It'll be with a click of a button. You can look at it on a map and see how it kind of is spread. You can also pretty much compare two different factors and see how they correlate. So it's really interesting. There's things like that. There's also, there's also social factors I know, such as,
Yeah, you don't have to remember everything.
yeah, binge drinking is on there. I know.
There's a lot. If I recall correctly, there's also environmental factors, yes, that affect community health and wellness. For instance, they have heat map data and cool mappings and models that we can look at. I think those are really important for us to tease out in our different subcommittees, I think, as we look to prioritize things for 2024 and 2025, our initiatives and policy decisions.
We have a lot more data, not only from City Health Dashboard, but from Essex County, but also from the state health department and the state DEP work together to look at community indicators. And so that's another great resource that has those heat maps. So we are working with, Environmental Advisory Committee and other department heads with that information. And if they need it, we'll be happy to share them and send them to those websites. But we're all about data because that's going to drive where we go and where our initiatives and programs are dedicated to.
Wonderful. Thank you. Those are all my questions.
Can you send those links to us too?
Sure. Yeah.
I mean, I think it would be really good at a department head meeting if you just shared it and talked about that, because I'm thinking, Ms. De Palma is going to come up here in a few minutes and talk about proposals, CDBGs, is probably demographic information. We're talking about tree planting and the heat map stuff and all that kind of, and then even the language issues, because, we go door to door and hand out stuff. Your street's going to be paved and things like that. And we ought to be aware of how we should be targeting communities. And if you have that information already, it's just there for folks.
Yes. Thank you.
My microphone.
You're back on.
I have to touch it.
Yeah.
Don't touch this. Just touch it.
Yeah.
That's good. Can you hear me now? You can hear me now.
Yeah. Yeah. I think let's not create a silo with this information. Let's distribute it widely internally so that we can make the best use of it.
Yeah, multiple departments can use different parts of it, recreation, police department.
Engineering, flood mitigation measures we might be undertaking.
engineering.
This information will be
Absolutely.
helpful and so
Right.
on and so forth. Yeah.
Yeah, and so this kind of supports the health and all policies perspective that we are adopting. So
Look at us. We are so on it.
Complicated to use that?
No, City Health Dashboard especially. Some of them, there's also CDC Places is another great one. That's local data for better public health. You can look at it on a map. It is a little less intuitive, but City Health Dashboard runs seamlessly. And they pretty much, from the moment you click one button, it gives you your list of options. And from there, it just presents it. And like doesn't give you, lists of numbers or whatever else. So that's what I enjoyed about it, especially as I first started. It really does make it as simple as possible while also kind of maintaining the bigger picture of it. So
Do you know where it's getting its data? Is this cell phone related data and things like
So under each measure, I know they utilize several different sources. But when you click on the individual measure, so for example, when you click on uninsurance rates at the bottom of it, it'll say data received from CDC or data received from census. And you can also request the raw data if you were someone who wanted to run different numbers and equations with that.
what's beautiful about City Health's dashboard, which I couldn't emphasize when we first enrolled in it, was the ability to really parse out what our needs are in the community. And so that uninsured data, the shortage of preventative services use data, that's significant because now we can say, this is where our mobile health screening should go that we're partnering with. These are the people who we need to target in Haitian Creole and in Spanish health insurance information. So this is where we're going.
Yeah, absolutely. It's great data and thank you. Thank you. That was very valuable and helpful.
Any other questions from my colleagues?
I just had one for Ms. Davenport. How many dogs do we have? You said we went up like a lot during COVID, so.
We have about a little over 800 dogs
Okay.
and that are licensed.
Right.
So if anyone has any residents or neighbors that have dogs that don't have a license, have them call the health department or register online through our
Go turn them in. Is that what you're suggesting?
No. But we do really want to make sure that we have a census of everyone, and we really want to prevent those dog bite incidences. You can imagine when residents call, they're frantic because their kid got bitten and they don't know what the status is of that dog. If we have a license, we're able to show them this dog had their rabies vaccine, and that puts their mind at ease.
You know, if do you have any stats on those dog bites? Are they from unleashed dogs in the parks, or are they
Yes.
in the home?
Some of them are from dogs running at large in the parks, which is why we have that ordinance that says no
Yeah, I
dogs
know.
running in parks. Some of them are dog on dog. Some of them are unprovoked. The dog was just being protective. So there are different incidences. But yes, if we could have people abide by the leashing of their dog and walking if their dog in the park and not walking without a leash, that would be super helpful and reduce a lot of our incidences.
Okay, thank you.
Any other questions? As far as the licensing goes, is there any kind of aid for folks who may struggle with being able, I understand it's only like $15 because I have a dog and a cat and I've done mine as well. But for some folks, $30 for their 2 pets might be a little cost prohibitive.
That's something we can explore with finance. We've never been able to or never really investigated into that particularly, because usually people say, I can afford $15. I can do this. However, if there are people who need to license their pet and it becomes cost prohibitive, we do have an animal trust. This is where part of the money from licensing goes. And if that can be used to assist, we can use it that way. But I'll need to talk to finance and the state health department if that's feasible.
Okay, thank you.
Mhm.
Anyone else? All right, then I would invite the public to ask questions of our health officer or Ms. Taylor. Mr. Wary, will you help?
There doesn't appear to be anyone in person.
If any members of the public on Zoom would like to speak, please raise your hand and we will move you over to public portion. I am moving over Joan Crystal. Miss Crystal, you're now in public portion. Please unmute yourself and you can speak.
Thank you. I'd like to ask Sarah to please share with the Seniors Advisory Committee those issues that she's identified through the dashboard that the committee should be focusing on so that we can better serve our senior community.
Yes, I would be more than happy to send that information along in the Senior Advisory Committee email chain. And I'll also pass it along to Ms. Markarova to talk about at the next Senior Advisory Committee.
And we can make sure that our liaison facilitates that. Committee member Kripe as the governing body liaison to the Senior Advisory Committee.
Thank you.
Other members of the public would like to speak in public portion, raise your hand now. I see no other hands, Mayor.
Thank you. That was quite the discussion period for our Board of Health. Our next meeting is January 2nd, 2024. And on that note, I move to adjourn our Board of Health meeting.
Second.
Ms. Adams? Yes. Ms. Kripe? Mayor Daffis?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Deputy
Thank you.
Mayor, on that January 2nd, there may be some discussion on that,
Yeah.
correct?
Yeah.
The next meeting, January 2nd.
Yeah.
Yes. Stay tuned. There might
Talk about that.
be some discussion about that meeting. Perhaps.
All right. Well, happy holidays, everyone.
Happy holidays. Thank you. To you, Mayor.
Thank you, Deputy Mayor Engel. I invite our Director of Community Development, Annette DePalma, to lead us through the CDBG public hearing. Ms. DePalma, welcome this evening.
Thank you. Good evening, members of the Township Committee. So this is the second public hearing on the Township's application for Community Development Grant block funding. We're applying for what are commonly known as curb cuts, more specifically known as ADA compliant detectable warning surfaces. And those are the rubber, they're made of rubber and they have the raised surface that you find at intersections. So we are applying for $232,000. And we're hoping that it will fund the construction of about 30 ramps, including the ancillary concrete work. And the locations are in a variety of places, some near schools. You know, essentially, we're doing the ones that are in the poorest condition, the intersections at the poorest conditions. And it's a fairly simple, straightforward grant. We hope to get as close to that amount as possible. And do you have any questions? Yes, please.
Are there questions from the Township Committee?
No.
We'll segue over to questions from the public. Seeing no one in person, we'll move to online.
If any members of the public would like to speak on this topic, please raise your hand now. I see no raised hands, Mayor.
Thank you. Seeing none, we'll close the public hearing.
Thank you. If you would just be so kind as to sign the attendance sheet, that would be great. There.
Thank you, Mr. Palma. There will be another hearing about this on the 19th. Yes. There was a publication concern and we're going to make sure that we're compliant. So there will be a third hearing. Okay. Administrative reports. We'll start with Township Administration. Mr. Wary.
Thank you, Mayor. A few items. First, we received today our responses to the Homelessness Outreach and Support RFP. So that's good. We got a good number of responses, a little over half a dozen. So we will begin the process of reviewing those. And we expect to have a recommendation to the Township Committee for an award in January. And we will share that information with you as we go along. The second thing is that reval letters went out, the revaluation letters went out this week. Residents started to receive them yesterday. And so everyone should, or every resident should receive that letter. We also sent out an email with resources, frequently asked questions, databases that support the, how we arrived at the numbers that are in the reval. So I encourage everybody, if you didn't get that email, it's also posted on our website. We have a page dedicated to the revaluation. So you can go to that page and look at that information. We have that information translated into Spanish and Creole, and that is posted on that same website. We'll continue to provide information to the public via email, some social media as well. Regarding, some follow-up information from questions that we're receiving, also reminders about the services that are available through the company that does the appraisals. Any resident is able to call them with questions and discuss the specific characteristics of their property. They can have that conversation over the phone, or via phone. They can also schedule an in-person meeting. Those are held here in Town Hall, and we have them through December and one of them in January. So anybody with questions, I'd encourage to take that opportunity to speak with professional property appraisers to understand more about their specific assessment. And lastly, the Township Committee had entered into a shared service agreement with South Essex Fire Department for sharing an administrative employee between us. It was someone who had served in a support role to the fire department. The agreement started July 1st of last year, and it was for a 50-50 split of those services. it turned out that Maplewood continued to use some more services for our operations outside of SEFD. So we have worked with the attorneys for both the township and for SEFD to draft a revised agreement. We've discussed that with SEFD, and we are asking tonight if the township committee is in favor of us entering into that revised agreement.
Yeah, what we'd just like a motion to say that there's going to be a modification of that agreement consistent with what Mr. Weary has reported in terms of the repayment of, or the allocation of services for Ms. Ross.
Move it.
I'll second it.
Ms. Adams?
Yes.
Ms. Wright?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Mayor Daffis?
Yes.
That's my report. Thank you, Mayor.
Did you want to report that you now have a little bit of help?
I do have a little bit of help. So
Thank you.
today, Heber Jones started. She is the new assistant administrator for the township. So that is very exciting. She is still transitioning from her previous role as a director of HR for a large school district. So she will be with us Tuesdays, Thursdays, and hopefully Fridays from now through the end of the month. And then she will be starting full time with us on January 2nd. So she hit the ground running today. We took her around. She met the majority of department heads, and we are already started to give her some work, which she is eager to take on. So we're excited about it.
Wonderful. Thank you, Mr. Wary. Any questions from the Township Committee for Mr. Wary?
I have one. We have resolution 391-23, which is applied energy engineering.
What number is that?
391-23.
Yes.
17J.
What is that?
So this is an open-ended contract. It's not for a specific contract or for a specific project, but our engineering department relies on this company throughout the year to provide engineering services, specifically around electrical buildouts. And I think part of this was for the build out of systems to support our electric charging stations. And in aggregate, those awards exceed the pay-to-play limit. So we'll enter into this open-ended contract, which satisfies the pay-to-play requirements from the state.
Thank you.
Other questions from the Township Committee for Mr. Wary? Mr. Wary, I ask you to, I know this information is on our website, being that people received their reval letters the past couple of days. I wonder if you would just kind of walk us through the public. We understand it, but the public, what to expect next. This letter is what? What is it not? And what comes after the letter?
Sure. So the basis of the reassessment is to look at every property in the township and set what is the fair market value for that. And what happens is over time, as people make upgrades to their homes or don't make upgrades to their home, the assessed value that we have on the books could start to differ from the fair market value. If you were to sell your house today, what would you get for it? And so we were ordered by the county tax board to undergo a revaluation. That reval is triggered by specifically two things. One, in that the fair market value started to differ from our assessed value by what the county considered too large margin. And the second piece is that the assessed value and fair market value, as considered across the municipality as a whole, was considered uneven in that some areas of town were valued either too high or too low compared to other areas of town. So the county orders us to undergo a revaluation. We look at every property in the township and we assess what is that fair market value. And that fair market value then becomes their assessed value, which will go on the books for the 2024 tax. We mailed out a letter which includes your 2023 assessment and what you paid in taxes in 2023. And then it includes your 2024 assessment, and based off of the 2023 budgets, and those are the budgets for the school district, the town, and the county, based off of the 2023 budget and your new assessment for 2024, what you would pay in taxes, right? So that does not consider what you would expect to be a natural increase in budgets for those those three taxing entities, right? But that'll at least give residents some idea of what they can expect to see in taxes next year. As far as what they can expect going forward, you have every resident has an opportunity to understand more about their assessment by speaking with professional property appraisers. And they have that opportunity through December and then into January. After January, we will finalize those assessments and we will mail out final assessment cards in February. And that'll show you what your assessment is for the 2024 tax year. After that, the next thing you would see is after the school, town, and county strike their budget for 2024, we'll mail out a final tax bill. That typically goes out for the July quarter of 2024. So as is typical, even outside of a reval year, your first 2 quarters of taxes are based on your prior year total taxes owed, and your third and fourth quarter taxes are balancing quarters. So they take what you've already paid in the first and second, your total taxes owed for the year after those budgets are struck, and you typically equal would pay in those payments in the third and fourth quarter of next year. So come the July quarter, which is the third quarter for 2024, residents should have what is their final 2024 total taxes.
Thank you for that. You can drink some water now.
No,
you need some water. I can tell you're dry. Yep.
And just one other thing, this whole process was started because the township was ordered by the Essex County Tax.
That's correct. I mean, this is a large process and it's an expensive process, and it's not a process that municipalities typically undertake without being ordered. So we were ordered by the county, and the county ordered between the years, I think it's 2022 and 2025 that we looked at. They ordered 9 of the 2020 or the 22 municipalities in Essex County to undergo the reval. So we are not unique in having to undergo this revaluation.
The 5 days are listed. I'm sorry. Finish up. Sorry.
Oh, go ahead.
No, the 5 days that are listed on the bottom of the letters actually are the 5 days that people can apply to come in and talk to somebody. But what if those dates don't work?
They should speak with professional property appraisers. I mean, we can add dates and adjust dates as needed. We'd like to fill those spots if those spots work for people's schedules. If a resident cannot have that conversation over the phone and cannot attend one of the programs, speak with professional property appraisers. And our goal is to accommodate everybody.
Thank you.
You're welcome.
Yeah. And the last thing I want to offer is for the public's edification, is that for obvious reason, this whole process, the Township Committee, the governing body, is firewalled from it for obvious reason. We're not involved in the process. We did not know what anyone's assessment, how it was being determined at this stage, what anyone's assessment is. And that's a good thing, that the governing body should be walled off and not have any undue influence on the process. So I think it's important for people to understand that if you don't see us commenting in social media threads where you traditionally tag us about your concerns, we shouldn't be commenting, because as the elected officials, we are not involved in this process. We are firewalled from it so that the process is a good process, right? That is why we're asking folks to make a call to the township, to connect with the appraiser company, and to have your questions answered by the professionals. They will tell you what they considered in the reassessment of your property. They will show you your personal record. They will go through that with you, and you can have that conversation with them. You can tag us, of course, as you wish, the elected body members, but we will not be engaging with folks about this because we are firewalled from it for good reason. Okay, enough about the reval at the moment. Anything else, Mr. Wary?
That is all. Thank you, Mayor.
Thank you, sir. Township Attorney, Mr. Desiderio, any update?
No, I have nothing to report, Mayor.
Okay. Thank you, Mr. Desiderio. You have one meeting left with us. One meeting left.
To that effect, Mayor. 19th.
We are very sad.
I intend to give a
And perhaps we can do something special on the 19th for Mr. Desiderio, if not that evening, maybe after the meeting or something like that. Wink, wink over to the clerk's office. Okay. Speaking of the clerk, Ms. Fritzen, good evening. Your report, please.
Yes, good evening. So I just want to reiterate that our program today, the mayor of the day, Teddy, just wonderful. I want to extend a thanks to my colleague, the deputy township clerk, for helping plan, writing the proclamation, being very involved in it, and my fellow department heads who, participated in today to make it special. And I would say, nothing was done on the fly with this. It's really a nice program for this family and this 7-year-old youngster who he's kind of scary. He is very bright and and we all had a good time. So I wanted to, acknowledge the mayor's participation as well as my fellow department heads. So the rest of my report is not too long right now because when you discuss items 1 and 2 on the agenda, I'll have a lot more to report. But in the meantime, we're at year's end and we would be preparing. I mean, after I get some answers I'm in need of tonight, we will be preparing for a reorganization meeting. And, we're looking to finalize township committee dates, holiday dates for the township. So again, I'm going to, sit tight and wait till those discussion items come up. And then, we'll be doing whatever you direct myself and my staff to do.
Thank you, Ms.
Thank you
Fritzen.
very much.
Thank you. Thank you for everything as always. Any questions from the Township Committee for Ms. Fritzen?
Yep.
And thank you again for your participation, your active participation in the Mayor for the Day events. And thank you, Deputy Clerk, a lot for being a real part of that. I mean, you really set up the day beautifully. And, it is the kind of thing that we should be doing more of. We need to bring our government to the people, right? This is their government. This is their tax dollars at work, and they need to know what happens in this building and why, and who are the people responsible for everything that happens. So it was a pleasure to do, and we should do more of it.
Well, the good news is we are doing it again because we had another auction of a deputy mayor of the day. And so I haven't told you yet because things were a little busy yesterday when I saw you, but we're scheduling it to figure out when to do it. And then I was going to reach out to you. I was going to find out some interests and figure out. And then the mayor said he would let me know what you guys did today and we'll plan a fun day. So
we have a template for you. It's all great. Wonderful. Okay, we'll move over to reports from elected officials. We'll start with you, Deputy Mayor Engel.
Thank you so much. I do have a report this evening. I first want to talk about the pool. We, as you may know, we've been under construction on our pool. We're putting in a major investment into our pool, which is really exciting because we love our pool for the future. But of course, whenever we're taking on an infrastructure project, you never know what you're going to find. And in this case, we found that the porcelain on the bottom, not the porcelain, something on the bottom of the pool, I'm not good with material names, was very thick. And so with winter here and with the way the weather's been unpredictable, we're just nervous about finishing up and getting the pool ready for Memorial Day. So we are going to have the opening day of our pool Father's Day weekend this year. And if everything goes well and we finish before and everything's great with the chemicals, we'll see what happens. But right now we're going to plan for a Father's Day weekend opening so that we don't have to delay. And so we're very excited for the investment that we're making. So I thank my township colleagues for helping pass that earlier this year. The second thing I wanted to talk about is last night, Mr. Wary and I hosted a bike and pedestrian safety meeting with some community members who have reached out advocating for safer bike trails or lanes, running lanes. So we had a very productive, I thought, working meeting to talk about a plan that we had or a consultant that had created a report in 2010 and talk about some of the issues we're seeing in our township right now. And the group is very collaborative, very smart, and we all have some homework to do. So more to come on next steps on that. And the third thing I wanted to mention is this weekend is the winter market, which everybody knows how much I love that market. This year it's moved to the gazebo, given that Yale Corner is sad with some environmental cleanup. So we'll be at the gazebo Saturday and Sunday, Santa and Mrs. Claus will be attending on Saturday, and Santa will be returning on Sunday. So I hope that everybody remembers to shop local on Springfield Avenue, visit the gazebo. We have some stuff going on at the Arts Center. All of our small businesses are open. Very excited for you to spend your money locally this holiday season. And that is my report. Thank you.
Thank you. And I believe for the winter market, we're also providing transportation up and down the avenue. Is that correct? Do I remember that correctly?
It's on.
I don't know about that, but I will throw that over to Mr. Luke.
I don't know if that was,
Our jitney service is not
no,
doing
that was just that, unless they worked it out with you. Yeah.
in discussion. What are we waiting for? It's almost Wednesday. Okay. Okay. Sorry, everybody out there. I misspoke apparently because that's not happened yet. But come on out and shop on Springfield Avenue, and nonetheless. Any questions for Deputy Mayor Engel?
Is the opening on Father's Day the same as Memorial Day, where it'll be the Saturday and Sunday soft opening, or will it be the full opening?
We will have more information in the new year once we figure everything out.
Thank you.
Thank you. And again, a major investment in our pool for generations to come with retiling and replastering. It's a massive infrastructure improvement project. So I'm glad we're doing it. Okay, Committee Member DeLuca, welcome home.
Thank you. No report.
After your wonderful trip abroad. Committee Member, well, actually not abroad. It's still in the continental.
It's still part of the States.
Still part of the States. It doesn't feel like it when you're there. Committee Member Adams.
I have no report, Mayor.
All right. Committee Member Kripe.
A tiny report. Mostly just to alert folks of the various events that are happening in and around the town. December 10th, Durand Hedden's Gingerbread House Contest begins again. There's always this wonderful group of young girls who come in and destroy us older ladies who think we know things, and we get told that we don't. It begins at 1:00 on December the 10th. December 11th is the menorah lighting at the gazebo on Springfield Avenue. Please come out for that, as well as the tree lighting on the 17th at 3 p.m. It's also certain somebody's birthday, but we'll talk about that later. For folks who are looking to contribute to folks in need this holiday, the Senior Center is conducting a hat and glove drive locally, but we need folks to volunteer to adopt a child, basically. But you have to get your letter or your request in to Michelle Wesley by the 12th. Otherwise, you won't get matched with the child. So please reach out to her at the Township website. And all this information is on the website, on our Township website. Dickens Village is open, and everyone has had an opportunity to go back out there and check it out. There are a couple of changes in there, but I'm looking forward to seeing the little houses and all the people who go visit. The little ones are so in awe of the fact that everything is so small and they can actually see it. It's one of the few things that's their size that we offer in this town. And just a final note on the winter holiday bazaar, as the chair of the Public Safety Committee, jitney or no, Springfield Avenue is 35 miles an hour. And we have people who are going to be walking back and forth with bags, with their children, hopped up on sugar, whatever it is. Leave early, drive slower, watch out for pedestrians, and have a good holiday. And hopefully everyone will have a safe one as well. That's my report, Mayor. Thank you.
Thank you, Ms. Kripe. Any questions for Ms. Kripe from the Township Committee? Thank you for your report. Yes, the holidays are here, and we started things off with our tree lighting in Maplewood Village. We did have a little bit of a hiccup. Committee Member Adams and I were there.
It was lovely. There was
not our reading of "'Twas the Night Before Christmas." That was perfect.
Our reading was great.
Not even our singing. That was not bad.
What?
I think Miss Adams has quite a voice on her. She really does. We'll do karaoke for the TC sometime. Don't come and watch that. Anyway, so the holidays are upon us, and thank you, Committee Member Kripe, for mentioning the menorah lighting. It is a two-town event at 6 p.m. On the 11th, Monday night. Come on out at the gazebo. It's going to be wonderful in light of everything that's been going on and our bringing the community together. This is the event to be. Let's all come together. Let's all come together. Last night, the MVA, the Maplewood Village Alliance, had its last meeting for 2023. At that meeting, we got to meet our new MVA ED, our new manager, Ronella Walker. And she will be making more appearances in the new year and getting to know people. She started sort of unofficially about a couple of weeks ago, really started this past week. She was at the Maplewood Foundation's gala on Saturday night, which Deputy Mayor and I and committee member Adams had the opportunity to attend. Congratulations to the first grantees of the first year of the foundation. Excited for all of them. The MVA was one of those grantees, and the new ED, Ronella Walker, was there. So that was wonderful. And lastly, we did already report tonight, and now there's an awesome, clean, very accessible blog post about it. Thank you to administration, Mr. Wary in particular. I know I've been asking you to work with Boxcar to see if they can provide some service to us. And it so turns out that we really needed an alternate commuting option for folks this week in light of the significant disruptions to the Morris-Essex line. So starting tomorrow morning, we've published in social media threads. We'll make it available. Can we send out a town email about this? Or no? Should we send out a town email about this?
We can discuss with legal. I mean, my concern would be promoting private business.
Yeah.
Okay. Okay. Yeah. I mean, commuters want to know, and there's a lot of more commuters heading back into the city. And you can see for yourself, the social media threads get a lot of comments and attention. So the boxcar service is an alternate option. It is not your prime option, and it certainly is not cheap. It's just an option. We worked very hard to get something available to folks for this week, at least until the M&E service is restored. And yes, we continue talking to NJT and doing advocacy with them about their overall service and how unreliable it has become and frustrated a lot of our residents. So that advocacy will continue as well. All right, that's my report. Any questions for me? All right, we'll move over to discussion items. The first one is about a holiday, Juneteenth. Mr. Wary?
Yes, thank you, Mayor. So we honored Juneteenth in Maplewood, and we are setting our calendar for 2024. And there was a question this past year about when Maplewood honors Juneteenth for our employees and when we should honor it. So the question is between the state holiday designated and the federal holiday designated. The state holiday was enacted first in 2021. That is fixed on the third Friday in June. The federal government then enacted Juneteenth, and that is actually celebrated on June 19th.
The actual holiday, yes.
On the actual holiday. So the question is which one we want to follow for our employees and for closing municipal operations. I think that, anybody would agree if we were all to do this at the same time, that Juneteenth on June 19th makes the most sense. This is a holiday set on a specific date to reflect on what actually happened on June 19th, when the last slaves in the U.S. were notified of their freedom. And so, I think that is the proper day, but it does require some consideration, because not every municipality in New Jersey will follow the federal on June 19th. And our school district, at least in 2024, is following the state. So they will observe Juneteenth on June 21st in 2024. So
why is the state not just following the federal?
Because they have to change the law.
That was my question. Are they going?
Change the law, and they have to negotiate with bargaining units.
Right.
So it's a much harder thing. I think we should be a leader here.
I do.
Agreed.
4th is on July 4th because it's Independence Day. Juneteenth should be on June 19th because it's an Independence.
I agree.
That's in line with our community's values. Yeah.
Easy discussion item.
Boom, keep it moving, because I was going to extending our meeting.
The annual reorganization meeting, the next discussion item I put on here. Our annual reorganization meeting has a long tradition of being on New Year's Day. This year in particular, we also have a township committee meeting the following day, Tuesday evening. And so my first question, taking the temperature of the township committee, is whether or not folks are interested in keeping that Tuesday night first TC meeting of 2024. We could consolidate it with the reorg meeting on New Year's Day. Any business we would do on Tuesday night, we can do on that day and cancel the Tuesday night meeting, or we can have both meetings. How do people feel about that as a
I
starting
think
point?
we should just have the one meeting, but could the Board of Health meeting be the second January meeting then instead of on January 1st?
Mhm.
Like January, what would it be? January?
No.
It has to be.
In January, I would expect that's how that's gone in the past.
Right. If the Board of Health meeting would be the second meeting. in January.
Yeah. So we'll just do a January 1st reorg meeting with whatever business.
And
Board
that's
of Health will be at
another,
the second one.
2024 annual meeting notice that we do anyway. So we would make that change.
Okay. How do the rest of you feel?
One meeting.
One meeting.
One meeting. Okay, wonderful. Now, the next question you may not have an answer to, and you can have your feels about it, and we can talk about it another time. But we have also sort of never taken official action about this, but talked about it offline about whether or not we should continue having our annual reorganization. Again, not for this year because it's so fast upon us, but in 2025 and beyond, if it should remain on New Year's Day, or if we should consider it being another day, the first week of January. I'm going to turn over to legal to see if there are any legal issues with that.
Statute says no sooner than noon on January 1st or within 7 days.
And which statute is that?
That's the statute that governs townships. You want the specific site?
No. I mean, like, it governs township committees.
Yes.
So all township committees in New Jersey have
The government, correct. Have a reorganization meeting January 1st. No sooner than noon on January 1st. Okay. Or within 7 days.
Okay. Well, that answers that question. Ms. Fritzen, there you go. I tried.
So wait, it doesn't have to be on January
We
1st.
said or
It has to be
Noon or 7 days, within 7 days.
I didn't hear that part. Did you say that?
Okay, the township committee shall hold an annual meeting on the first day of January at 12 o'clock noon or during the first 7 days of January thereafter.
Okay. All right. I didn't hear that part
Said
the
it.
first.
Sorry, I thought I said it.
You did.
Okay.
You did.
Okay. So how do we feel about it? Keep it.
I would like to keep January 1st.
I knew you would say that. Tradition. Ms. Cripe.
I'm kind of torn. I like January 1st as well. At the same time, I also kind of feel like folks would be more present if there was a different day. Or
More present? I think they'd be less present if it's a
you
different
think they'd be
day.
less present?
Because everyone's home.
Yeah, I think they'd be less present because they have to sobered up.
It's fight, but I will tell you that it is a slice of Americana on January 1st.
It is.
Absolutely. It is
Absolutely.
spectacular.
Okay. I don't disagree. Just
30 years I've been coming and it's just,
tell us how you really feel.
it is just Americana. I think it'd be a mistake to make it any.
There are municipalities across the state doing it. It's part of a whole thing of government and democracy and celebrating that.
I think the January 1st people are in a minority though, right? Most municipalities do not do it on January.
They do.
Do they?
Most do. I don't know any that don't.
A lot of them do.
Does Dario?
Even those that are not township committee forms of government, there's like Red Bank, Summit, like just ones that I've worked in. I'll do it on January 1st.
Okay. Asked and answered.
First.
Asked and answered.
I have asked the clerk to do it a little later than.
Right.
Well, I have asked.
I mean, you'll remember last year we had it at 2:00 and that's because it was Sunday.
I know.
By tradition, okay? If it's a Saturday, we start at 1. If it's a Sunday, we start at 2. So here we are back to Monday, and it's normally every other Monday through Friday, 12 noon. But again, that can be worked out.
Oh, yeah. That
Okay.
time can be changed.
2:00 worked nice last time.
Yeah.
Yeah.
So, okay, asked and answered. I'm moving on from this before I get beat up even more.
Well, are we interested in changing the time for this year?
I need
You
to
haven't
know that.
publicized it yet,
I
right?
need to know that.
I would like a later time.
What do you think about a later time,
Yeah.
incoming mayor?
I've been advocating for a later time on New Year's Day.
What time? What time?
Say 1 or 2 o'clock.
No,
your preference?
no, what time? One or two?
Pick.
Pick. You're gonna be the mayor.
1:30.
Pick.
No.
No, on the hour.
You want to say 2 o'clock?
What's everybody?
1 o'clock or 2
No,
o'clock?
you're the incoming mayor. This is your big reorg.
Yeah, pick, propose a time.
It's giving me this.
I've been going like, that's not.
2 o'clock, 2 o'clock,
2 o'clock.
2 o'clock.
2 o'clock.
All right, done.
You're welcome.
All right, there you go.
And that's got to be solid, right? Because
2
we have
o'clock.
to get our notices out for the year.
2 o'clock.
We're solid, 2 o'clock.
I will just say for the record, I agree with this and we'll move forward with it. Obviously, people have very strong opinions about this. But you know, it does tax our department heads being here on that holiday day. It is a day off for them.
Sweet noted. They get paid and we don't. So they.
Yes, but that, you know, we can't be cavalier about that. Can't be cavalier about that.
Do it if they worked in government for a long time.
Used to and liking it are two different things.
Yeah.
People got used to slavery too, but
Oh, come on.
you know, like, no, but I'm saying like, it doesn't make it right. It doesn't make it right. But anyway, okay, we're moving on to the third discussion.
I'm sorry. Says that, who will I coordinate with? Ms. Adams?
She's the
You
incoming mayor.
correct about, you know, what other aspects of New Year's Day you want to continue, bring back. Mr. Lewick, you and I have spoken, you know, a little bit because you will be sworn in, and Mayor Daffis as well.
Right.
So, you know, I'm going to be looking for a lot of direction because we're going to have to really plan in the next 3 weeks.
Yeah, we'll provide
Right.
it. We're here for
Yeah,
you.
the way this works is the incoming mayor and the people who are being sworn in are the ones who give the most input. We've already,
Right.
That's what I'm looking for.
Yeah.
but you're gonna get that.
It's the
Yeah,
same
you're gonna get
we've
that.
Done it. So, yeah.
We already decided on a group, right?
Miss Cripe and I will just sit in the back and
I
we'll.
want like a 3-hour reorg meeting.
What
Well, now that we started 2, we don't want to go to 5, so.
No, not
Well, you know, now that you started too, you probably don't want food.
Oh, God. Okay.
Mr. Desiderio?
And I'm not suggesting it's going to be 3 hours, but you're going to have other agendas.
Yes,
Right.
yes.
We will work on.
Let's not make this more complicated.
Yes,
Consent agenda, we're gonna have one vote.
yes, yes.
Safe not fly.
Let's not make it complicated.
Yes.
As I said before.
Yeah, absolutely.
Okay. We're gonna move on. And we have another discussion item here, number 3. We have a presentation by one of our first cannabis delivery class 6 license applicant. Miss Wahida Jackson is the applicant. Wahida Jackson has provided the local cannabis review committee a complete application. We asked for supplemental information that was provided. And I understand that she has also received local zoning approval for her cannabis delivery. This is a class 6 license. Think of it like Grubhub, the person who delivers from your favorite restaurant your food. This is the same thing. This is again part of the state law that has legalized this, and we have allowed for it in our local cannabis ordinance already. We have not approved any cannabis license delivery licenses just yet. And tonight we're going to hear from our first applicant who's with us. And we're going to let her do some talking, let us know what her delivery model looks like. And we will have the opportunity to ask questions afterwards. So welcome, Ms. Jackson. Can you hear us and see us?
Yes, I can. I can hear and see you.
And we can do the same with you. Thank you for making the time this evening. Would you kindly let us know who you are, introduce yourself, and walk us through your application?
Yes, thank you. I'd like to extend my sincere thank you to the committee for having me this evening. My name is Wahida Jackson. I am a resident of Maplewood. I've also resided here for over a little bit of a year and a half, and I am no stranger to the community. I grew up in Box Hall, also was a prior resident of Orange, and have been a longtime Essex County resident. I have a presentation I would like to share this evening. As Mayor Daffis has mentioned, I am an applicant for the Class 6 delivery license, the first in Maplewood, and minority-owned, women-owned business. Let me share my presentation. Okay, can everyone see?
Yes, we can.
Okay, thank you. So the name of my company is Bud and Leaf Delivery. As you can see, going for Class 6 license. Just a bit about ourselves. We're a certified women-owned business, certified minority-owned business. We're qualifying for social equity, micro business applicant, 100% women-owned. Oh, can you hear me?
Yes, we can.
Okay.
No, we can.
100% women-owned, and we're going for our annual license application. So just a little about myself. I am the principal owner and president. I received my master's from Rutgers University. I am a certified anti-money laundering specialist, meaning that I have a background in the financial government, well, not government. My background is in anti-money laundering laws. As you know, in 2001, the U.S. Patriot Act was passed shortly after my graduation. So I've been in the industry for over 20 years. I've helped financial institutions mitigate their risks related to financial crimes and money laundering and sanctions risk. I've had over 20 years experience, a bit dating myself, in the industry. I've also consulted. I still have a consulting practice where I serve small startups in the crypto space, which is a high risk, minimized, highly regulated industry. If you want to look from the scope of like how it's not federally regulated, but is regulated by each state jurisdiction as they do require money transmittal licenses. So I'm very familiar working in a very heavily regulated industry, dealing with state jurisdictions and also dealing with federal regulations and requirements. I'm a proud resident of Maplewood. I've purchased my house on the Hilton side of the Township Village, and I'm excited to be a part of the community. We have two owners, LaKendra Moses and Donna McCoy. LaKendra is the owner and vice president. BLD is the short term for Bud and Leaf Delivery, just the acronym that we'll be using straight forward from here. Over 10 years of experience in the financial insurance industry. She's a proud mom and avid baker for cannabis-infused baked goods. Donna McCoy, she is the chief operations of BLD. She is a retired federal employee of the United States Postal Service. She has 20 years experience in logistics and delivery, and she's a cancer survivor and advocate. I will go over a high-level overview of our operations. Our operations plan consists of consumer purchase cannabis from a licensed dispensary, not BLD. Directly from the dispensary, they will be notified when a customer initiates their order. So when you think about the courier model that New Jersey has adopted, it's specifically aligned with the Uber Eats model. We will not be holding any inventory, any sales on a premises. No visitors will be permitted. As you understand, I've been approved for zoning, which is my home, and I don't have any intention of allowing anyone at the facility other than the admin and myself. The drivers will have access to vehicles off the premise. They will not have vehicles housed here at this location. With that being said, upon receiving conditional approval from the state, we will look to locate a facility. Possibly, I've seen a location on Newark Avenue, a short distance up the street from me, to provide parking for those particular vehicles. The state does not restrict the location as to where I can have vehicles parked. However, they will not be parked on a premises. Delivery drivers will be of age, which is 21 years old. We will confirm their age at the point of prior to employment. They will receive a background check. Upon clearance of that background check, they will be provided a badge from the CRC documenting them as a cannabis delivery driver and authorized to transmit cannabis goods from the dispensary to the consumer. They will deliver only to residences, no employment sites or public places. BLD will always prioritize seniors, patients, as they do have prioritization. They do not have the requirement to have delivery fees associated with them. We will also prioritize Maplewood residents. BLD will, as I mentioned, will never store cannabis or directly sell to consumers. Now, this is a diagram of the retail to consumer workflow. I've partnered with the provider that has over 10 years experience. They're called Web Joints. They provide the technology and they plug directly right into the POS systems of most of the dispensaries that will be having their POS system. I chose them because they have a wealth of knowledge and experience. They've been designated in expansion in California and throughout other states. They've also worked with the CRC directly of the state of New Jersey to address some of the technological concerns related to the seed to consumer traceability. So I feel like they were very well versed. Technology, my background is also in technology, so I understand the nuances with the data and pushing for inventory, and that was one of my concerns. So I partnered with them and also spoke to the CRC about my concern for ensuring the traceability of cannabis from the dispensary to the consumer. So as you can see from this diagram, you'll see like it has a flex and feel of an Uber Eats model. The consumer will initiate their order via the mobile app or website. The dispensaries will have a marketplace on that website, a design and feel of the products that they will host in their store. The customer will log on. They can either go directly to a dispensary of their choice or search by goods. And from that initial point of purchase, they will make their payment on the website. That payment goes through the POS system and gets fed to the dispensary, and then we will split my commission. From there, the order is received at the dispensary. They will confirm, and that notification will get sent to the bud tender to fulfill that order. The order will have a QR code on the receipt. That QR code details the information that is required by Metric, and Metric is the designated traceability provider for the state of New Jersey that traces from seed to POS cell. And from this instance, it's going to trace from delivery to consumer. So that QR code is very important for traceability. Once that order goes through the portal, that bud tender is required to staple or attach that receipt to the package. Once that package is completed, they will initiate that within the portal, and we will receive that notification. The BLD driver will confirm and then go directly to the location to pick up. The BLD driver, once they pick up, they then will scan the QR code. And once they scan a QR code, that will start the tracking from when it leaves the facility. Once it leaves the facility, the BLD driver will then go into the car, which will be secure with a lockbox. The lockbox will designate and locate the GPS location, making sure that they are putting the package within that lockbox. Also, we will have a fleet dash cam that will look from the external view and internal view inside the vehicle. That also tracks GPS coordinates. It's a dash cam specifically for fleet drivers. So it is heavily logistics and traceability from that standpoint. That's the second data tracking. They're also through the application by our connection with WebJoint, because it's built into their and downloaded on their mobile app, it will be tracing the GPS coordinates as well. This will all also be having the oversight of our local admin that will be present at the facility here in Maplewood, tracing any deviations from any of those three tracking functionalities. And once the order is ready to be dropped off at the customer, the BLD driver will access the lockbox. The lockbox will send transmission back to our portal to evidence that they have accessed that product. They will then go, when delivering to that customer, they are required to validate the customer's ID. We also I don't know if I mentioned this, but at the point of sale, the customer is required to put in their identification details. They are required to have some form of scanning of their ID, but we do not maintain a copy of that ID on file, as it is against the policy of the CRC. but we will have the details that that it validates that identification at the point of sale. So the point of that is also to help the driver to understand like the credentials to validate against when they do see the copy of the ID at when they do meet the customer, to make sure that the customer is of age, and then they will have the customer sign off on receiving the product. In the instance, if that customer is not there at the location, or if they are unable to drop off the product, they will then initiate a notification within the application, the mobile app that they have on their phone, that they were unable to drop off the product. From that, it will initiate a notification to the retailer that we are going to be in transit to drop the product back off at the originating location of the dispensary. Once they do drop off at that particular site, they will take a picture as evidence of the drop off, and they'll get the bud tender to sign off on it. And this is just the overview of our security plan. Excuse me. Our security, as I mentioned, includes the lockbox, which, as you can see, that it's a lockbox that is tracked via application. The app will send real-time notification, internal temperature monitoring. So we want to make sure that, because these are perishables and we don't want anything happening in transit, the lockbox is secure to monitor that. It has Bluetooth unlock features, so we can change based on each driver to have a unique access to the box. Or any deviations, like I mentioned, will get reported back to our central portal and document for any deviations outside of the transit of the product. We'll have security cam, as I mentioned, that will have visibility externally and internally, and it's infrared, so it could be seen at night, so we could still see good visibility inside the vehicle. And it's a 24-hour alarm on all vehicles as well. Our employment plan consists of hiring 10 employees within the next 2 years. We are a micro business. At least 50% of Maplewood residents. We will prioritize a diverse workforce, 25 representation of 25 women, 25% minority, 25% LGBTQ, 15% ex-offenders, and 10% veterans. I am very committed to ensuring a diverse workforce. Also, I intend to partner with Rutgers University as they provide certifications to new individuals that are seeking to enter into the workforce. And CRC has a workforce that they are working with people to get them educated in the industry of the cannabis. Our charitable plan, I am an avid donating resident. I donate to the local pantry. I also have a standing donation that comes out my personal account to local pantries to ensure that, you know, any individual in the community at Essex County, they have access to food. I'm very near and dear to that. I am a court-appointed advocate for CASA. I work with youth to ensure that they have adequate advocacy. So I go to the courts and I ensure that they have shelter and their health needs and mental needs are taken care of. And my charitable plan is in alignment with my passions to help the youth and the community, to the individuals that need it the most, our youth and our seniors. So my intention is to collaborate with Maplewood Public Social Health. I've been down to the local senior center that is close to me. And I've showed my interest, but haven't been able to speak to anybody yet. So that's pending. I was told to go to the location that is more near the municipal building. So that is on my agenda. But my intention is to partner with the departments within the community to provide prevention and health in the community. That is also dear to me. I have a certification in nutrition. And as I mentioned, Donna McCoy is a cancer survivor. So, and my father is also a cancer survivor. So for me, it is important to have preventative care and advocate for that population of individuals as well. And I intend to partner with retailers and also host independent expungement clinics.
Ms. Jackson, I don't mean to interrupt you, but I must, before we lose our feed, I'm going to need to make a motion to extend our meeting beyond our 9:30 cutoff. So I move that we extend our meeting tonight beyond 9:30. Do I have a second?
Second.
Ms. Adams?
Yes.
Ms. Cright?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Mayor Daffis?
Yes, please proceed, Ms. Jackson. And sorry again for the interruption.
Thank you very much. So our status, we obtained our site control. The location is 2 Nelson Place, Maplewood, New Jersey. We've received approval for this site. This site is a multi-unit dwelling. The deeded property is 454 Boyden. However, it's 2 units. The unit of operation will be 2 Nelson Place. The administrative office will have no cannabis in inventory, no cannabis storage, and no customers on site or visitors. The zoning office has approved it. There was a copy submitted within the application. Our acquired capital is budgeted for 155. As I mentioned, we're a micro business. The intention is to start with 2 vehicles, as our prioritization is to scale into the greater Essex County area. However, we will be serving within the 15-20 mile radius of Maplewood. So with that, the labor costs, we estimated $100K, with the fleet of vehicles at $32K. As I mentioned, the purchase of 2 vehicles with the ability to scale to up to 6 within the first 2 years. Or within the first 2 years. Security equipment, 2,000, and miscellaneous, 21,000. And that includes any computers, our subscription with our partner WebJoint. Our proposed funding is through angel investors and family and friends. My representation of liquid funds directly from me of $80K. Marilyn D. Berry, which is a family member of 25, and the Mark Scott and Tawana Jackson, both pledging $25K. And here's a host of our clients and vendors. As you can see, some local faces, Cannabis Lady, Jill, and Noir, which is a local dispensaries that we have. I have been in conversations with them. Actually, Jill is a mentor for me, and I've been a patron of her facility for a number of years since she's had the CBD location, and accountants and our attorney advisors. So I am well suited and guided throughout this journey. That completes the presentation. I will leave this here for any questions that you may have.
Thank you, Ms. Jackson. That was great, informative presentation. I'm going to open it up to my colleagues on the governing body, the Township Committee, for any questions they may have. I'm opening it up. Any questions?
I would just want to say it's a great presentation, a great concept. You thought out a lot of how to operate this. You know, for us, this is very new because I don't know any other municipality that's as advanced as we are. We have 4 retail approvals. We have 1 manufacturing approval, and now we're going to be doing a delivery approval. And I think you are probably the best person to start us out with this because you've thought it all through. So I just want to congratulate you on that. You know, we did have, when we were reviewing this, there was the concern about, you know, you have to adhere to the home-based business, and you seem to be very clear about that. You know, no employees there and no signs there and no parking there and all that. So that's great. That's what I was most worried about. And your community benefit, I think the mayor is going to suggest something, but I like, you know, what you're talking about is giving back to the community because we've asked all licensees to do that. So congratulations.
Thank you very much.
Thank you. Other members of the Township Committee?
I also want to just say that was a great presentation, and I'm so impressed with your background and how you laid it all out on your business plan and everything that you shared with us. I really applaud you for your presentation. So thank you. It's nice to meet you, and I look forward to meeting you in person.
Thank you. Me as well.
Other questions? Yeah, I echo everything that's been said. Great presentation. I think you covered the security concerns. This is, as you stated, a highly regulated business. And thank you for walking us through from the order to the point of sale to the delivery point, and how that's going to work, and all the security measures being taken and, being deployed to make sure that the process is seamless. So I'm going to recommend that we provide conditional approval on your application, conditioned upon your receiving state approval, of course, but also conditioned upon the execution of a mutually beneficial community host agreement, which we could provide to you after the meeting tonight. We can have executed and entered into the record subsequently. Can you tell us, as it relates to that, thank you already for addressing this and anticipating this as an important part of this approval process for us. Can you tell us a little bit about your revenue model? Because what we have required in our community host agreements with the other licensees may not be possible with you because you're not a retailer, right? So you're probably only making, if I may guess, a commission on your delivery. Can you walk us through your revenue model a little bit more accordingly?
Yes. So the model for courier does not provide us the opportunity to have a revenue similar to retailer. So the delivery service will be an outsourced commission. So we will be basing our revenue from the commission directly from the retailer. And the state has capped a delivery fee at 10%. Also, we cannot charge a delivery fee to medical recipients. So our revenue is slightly different. We won't be bringing in the same revenue stream, but so I just want to make sure that there's consideration when the committee makes a decision on a charitable plan. Also, I wanted to clarify that although I am for application, I'm going for the annual applicant. So in order to go to the state, I have to have prior approval from the municipality. So I just wanted to make sure that the committee has that and taking that into consideration as the portal for the CRC for Class 6 opens on December 26th.
Right. And our intent is to get that back to you and come to an agreement with you before then. Mr. Desidero, did you want to offer?
I wanted to know, what is it that you require to submit to the state from the township? A letter, a resolution, what specific?
Yeah.
I read your application.
A local resolution.
Resolution? Okay.
Right. So it will follow, Mr. Desiderio, the resolutions we've done before with the other licensees. And again, I would move at this stage right here tonight that we provide a conditional approval conditioned upon the conditions we just stated. Is there a second?
I would second it, but I do have one question.
Yep.
Does the delivery service, are you charged an excise tax or is that not? Do you pay for that? Do we have that?
The tax is at the customer level. Is that what you're stating? The sales?
No.
So
Yeah, at the customer level. So they pay the
retailer.
Got it. Okay.
Right. Okay. You're talking about the host, the 2%.
2%. Yeah.
Yeah, the 2%. Yeah. Okay. All right. Mr. Desidero, do you need anything else from the township?
So it'll be a resolution to approve a Class 6 license to this applicant, subject to the finalization of state approval and an
executed community host agreement.
Community host agreement,
which we will work with you by email and have ready for you so that we can have the resolution adopted accordingly at our next meeting, which is
November 19th.
The 19th.
Does that work for you schedule wise?
Yes, it does.
Okay.
Great. I know it's not ideal.
What I will do is I will draft the resolution and I will send it to Ms. Fritzen, who will send a copy to you just to make sure that it satisfies your needs for the state. Because we don't want them to kick it back, okay? Because this will be the last meeting in December, okay?
Okay, thank you. I appreciate that very much.
Oh,
So we roll call?
All right, we have a second. So
Come again?
take a roll call.
Come again?
Let me take a roll call.
Okay, let's do a roll call. Yeah.
Ms. Adams?
Yes.
Ms. Cripe?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Mayor Daffis?
Yes. Thank you all. And thank you, Ms. Jackson. Thank you very much.
Thank you very much.
We'll be in contact. Well
Thank
done.
you. forward.
Okay, we have consent agenda. Can I get a motion?
Oh, you have another,
Do I have another item?
Yeah.
15D?
The resolution.
Resolution?
Oh, yeah, the resolution. My goodness. My goodness. I can't believe that. Okay. Yeah, I'm looking at an older version that I work with. Okay. So this is a resolution that basically summarizes the sentiments that were expressed by us and by members of the community who came, who had a dialogue with us at our last township committee meeting. It's a bit more balanced than previous resolutions. Obviously, we're at a different stage of the situation in the Middle East than we were earlier on a month ago or so. And this is an opportunity for all residents to know from us that we see them, we hear them, and we support them, no matter who they are, Jewish, Arab, Muslim, all of our residents. So the resolution, talks about how we pride ourselves in our intentional diversity and inclusiveness, and that we are an activist governing body, which has a long history of advocating for justice, condemning hate, promoting community health and wellness, supporting mutual aid efforts, partnering with organizations that promote cultural competency and sensitivity, and taking a stand nationally and internationally against oppression and legislating equality and opportunity for all persons. And we've organized and supported marches, rallies, vigils in condemnation of hate or violence of all kind, whether centered in anti-Semitism, Islamophobia, homophobia, transphobia, or xenophobia. And that we are an avid partner in the annual South Orange Maplewood Holocaust Remembrance Ceremony. Of course, when the Hamas terrorist attacks occurred on October 7th, we were steadfast in which killed more Jews in a single day since the Holocaust, taking over 240 innocent civilian hostages and triggering a war that has claimed thousands of innocent Israeli and Palestinian lives since, most notably those of children and women throughout the region, causing a humanitarian crisis and massive displacement. We've proclaimed our support of Israel and Jews around the world, but we've also caused for pauses in the war for sustainable humanitarian aid to Gazans and innocent civilians, among them Arabs and Muslims in the region, and we've called for peace for all in the region. We are not interested in engaging in the geopolitics of this because we are not experts, but we remain concerned about the well-being of all persons, Jews, Arabs, and Muslims. That is our duty. Jewish, Arab, and Muslim members of our community have pleaded for our support and comfort during this time of great uncertainty, anxiety, and fear, and at a time when anti-Semitism and Islamophobia are on the rise. Threats of violence are increasing, and angry rhetoric is inciting violence right here at home. As I mentioned, our Jewish, Arab, and Muslim neighbors have expressed their fear of not being seen, of not feeling safe, of being victims of hate, anti-Semitism, and Islamophobia, and of being silenced or isolated by aggressive and angry rhetoric, inciting violence or threatening violence. Again, right here at home. There have been multiple incidents of this recently in the past couple weeks in South Orange and Maplewood. So the Maplewood Township Committee has a duty to comfort all of our residents, keep them safe, and bring the community together. And by this resolution, we proclaim and commit to the following explicitly. We unequivocally condemn anti-Semitism and Islamophobia. Hate has no home here. We unequivocally condemn any actions aimed at threatening or inciting violence. Hate has no home here. We call for peace in Maplewood. Hate has no home here. We remain committed to being an open, safe, and welcoming bridge over painful, troubling currents and between opposing opinions, politics, and feelings toward community unity. We ask our neighbors, all of us, to exercise patience, show kindness, extend their hearts a little bit more, be empathic, and compassionate. So that's the resolution. I've shared it with my colleagues before tonight, and I would move that we adopt it.
Second.
Second.
So Mayor, can I just, we had a statement from Ms. Gordon earlier speaking about this resolution and asking us to, I don't think she actually said whether we should adopt this resolution or not. She was looking for a ceasefire resolution, and she made some statements. And I think one of the examples of the resolution is that people can come to a public body and speak freely about his or her feelings. And I think that's what really is the heart of that people should be able to offer their opinions. I just want to say, though, she made some statements that I want to say that I don't agree with her opinion. And that's also the other part of it, is that you're asking for a dialogue where we may not agree, but we can talk to one another. And I think that the statements of that, the war didn't start on October 7th that's absolutely, the history is there for a very long time, but let's understand that the reaction from Israel was because of the terrorist raid on October 7th. And we're finding out more about how horrible that raid was with the sexual violation of the women in Israel. These were civilians. And we did not hear tonight about Hamas being a terrorist organization, and they are a terrorist organization. And they don't represent the Palestine people, but they are a terrorist organization that wants to eliminate Israel. And I think we have to always remember that, and remember that, the pause worked because there was an agreement to give up hostages, trading hostages. Israel gave up some 3 to every 1 hostage that they were able to get back from Hamas. But there are still 200 hostages still being held. And I would disagree with Ms. Gordon about a ceasefire. I find this very difficult because normally I'm on the lines of saying no war. But I find it difficult to agree with her because it doesn't deal with those hostages. Those hostages need to be brought home. And then we talk about how do we move forward and get out of this? And I listen, I am not a fan of Netanyahu. I am not a fan of the right-wing people that he has put in his cabinet and the deals that he has made. And I'm not a fan of the indiscriminate bombing that is taking place. But I think that the good thing about their resolution is it doesn't make the equivalency.
Correct.
It cannot be an equivalency.
Correct.
The terrorists came into Israel on October 7th and went after civilians. They did not go after the government. They went after civilians. And so I think, yes, we need to have civility in our community. People need to go to the street if they want to. They should protest. They should speak out. I think that on both sides, we've seen too much on social media about attacking people, and that if you disagree, if I just said that I'm not a supporter of the actions of Netanyahu, does not make me anti-Semitic. It makes me anti-Semitic. It makes me someone who doesn't agree with him.
Right.
That's all. I still support Israel.
Right.
And the same thing, but I think we have to realize that the Hamas did this on October 7th. They came in and they created terror and fear and raped and killed and took hostages. And that has to be remembered. And so, yes, we have to work for peace. I think that we have to say to our communities that we have to listen to each other. We have to give each other space to talk. Just like I'm free to speak here and any one of us is free to speak here and Ms. Gordon was free to speak here. That's what I think the resolution is saying, is that you can say that. But I think as a public elected official, I have a responsibility to speak out and challenge some of the stuff that comes before us, just like they have a right to come and challenge us. So it's a lot of words, but I just wanted to say that I do support the resolution. I did make a little suggestion on a word change, but I support the resolution. I think that's what folks were asking us to do, but I think we need to have this dialogue and keep talking about it.
A lot of words that I completely agree with.
Yes, well stated words, well stated words. And, I'll say, a ceasefire is just not practical. It's never going to happen if Hamas will continue to be violent. And they've stated that that's their intent. Their intent is to destroy Israel and to kill as many Jews as they can. Hamas knew what they were doing on October 7th. It was premeditated. It's been planned for over a decade, apparently. And they knew that Israel will defend itself and, retaliate accordingly. And they were apparently okay with that. And they were apparently okay with using innocent civilians, women and children in hospitals, in schools, and in other places. Palestinians, they were okay with using them as human shields. And they are okay with it, apparently, because they have not said that they will stop. They have not said that they will disarm. So I also disagree with the ceasefire because I just think that yes, none of us wants war, but, we also have to, speak out against what is happening here and speak the truth of what is happening as well, while we remain empathic and compassionate. And thank you for mentioning the sexual violence against women. That got a lot of reporting this week. I've been following a lot of different news reporting and reading on my own as well. And that has just been incredibly painful and terrifying to watch. It is terror. They want terror, and that's what's happening. There cannot be a ceasefire with terror. That's it. That's the bottom line. That's how I sort of make sense with it in my mind. Any other comments?
I just want to thank my colleagues for all of your support during this time. It's been hard for me since October 7th. It's been very hard the past 2 days watching as a survivor, watching all of these reports about the sexual terror that was done on all these victims. So it's been very hard. So I just appreciate having you all as my friends and colleagues. And I think, Mr. DeLuca, what you said about even if we don't agree with each other in this community, we are one community and we are here living side by side. Our kids are at school together, they're playing together. And we just have to remember that we're a local Maplewood community and we need to stick together because we're all we have here day by day. And I just want to thank you all for being such good friends and colleagues and strong leaders. So thank you.
Thank you. Thank you. Okay.
And seconded it, but not voted on yet.
Come again?
We have to.
Oh, we have to vote. Yes, a roll call.
Ms. Adams?
Yes.
Ms. Croy?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Mayor Daffis?
Yes. Thank you all.
I move the consent agenda.
I second.
Ms. Adams? Ms. Croy?
Yes.
Mr. DeLuca?
Yes.
Ms. Engel?
Yes.
Mayor Daffis?
Yes.
Oh, comment.
Second public comment period. Any subject matter, 3 minutes. There's no one here in person. We'll move to online. Mr. Wary.
Any member of the public would like to speak, please raise your hand now and we will move you over to public portion. I am moving to panelist Avi Siegel. You are now in public portion. You can unmute yourself and speak.
Good evening, Mayor and fellow council members. My name is Avi Siegel. I'm a resident of Maplewood, District 3. And I'm here tonight partially as a resident, partially also in my professional space as an educator in our community. I spent the past 7.5 weeks going all over our own town, Essex County, Morris County, Union County, Somerset County, in my role of meeting with youth. and holding conversations, holding forums in which their voices could be heard, their concerns could be expressed, their ideas could be hopefully grown and enhanced in dialogue with each other as well as myself. And as you can imagine, the time spent with them has been challenging, to say it lightly. I feel the weight of responsibility as well as the onus of helping our youth navigate not only the crisis which you have mentioned, as well as the resolution you just passed, which has brought me to tears a few moments ago, in that our community can be a bastion of light and kindness to this world. So first and foremost, just thank you. A moment of gratitude to the hardworking elected officials in our community who are putting forth the message of unity, love, and community in which we all believe in. Secondly, in that effect, part of the youth experience that exists is looking at the adults in our lives and seeing the way in which we role model the values we hold and the ideas we believe in. And so seeing civility and seeing a place in which upholding each other as community members and not tearing each other down has been another ray of light that you as our elected officials can role model for our youth, a way in which we move forward together through dialogue, through engagement, and not through division. So just a reflection from one community member who's spending a lot of his time in the nexus of struggle, strife, challenge, and the unknown future. I'd like to say thank you publicly in our public space forum. Also, thank you for giving us an extra time to make this statement. And hopefully that the way and example in which you are showing for our youth is something that can be exhibited themselves, and we can see hopefully unity and coming together of our young learners that you have shown as adults in the stead. So that's all I wanted to share in this moment. And so I will end with once again, thank you, the gratitude from one community member.
Thank you. Very wonderful having you. And thank you for coming on to express all of that.
If any other members of the public joining us on Zoom would like to speak in public portion, please raise your hand now. I see no hands, Mayor.
We will close the public comment period. I move that we adjourn and meet again on the 19th.
Second. Ms. Adams. Ms. Craig.
Yes.
Mr. DeLuca.
Yes.
Ms. Engel.
Yes.
Mayor Daffis.
Yes. Good evening, everyone. Thank you for joining us.